topic is tuberculous meningitis etiology. Wait. My topic is tuberculous meningitis etiology, pathogenesis, pathological anatomy, and clinical treatment. Etiology: tuberculous meningitis, also known as TB meningitis or tubercular meningitis. It is a specific type of bacterial meningitis caused by the Mycobacterium tuberculosis. It occurs when tuberculosis bacteria, Mycobacterium tuberculosis, invade the membrane and fluid surrounding the brain and the spinal cord. The pathophysiology of tuberculous meningitis involves bacterial invasion of the brain parenchyma meninges or cortex, causing the formation of small subpiral foci. These foci, termed rich foci, are necrotic and spin as colonies within them and multiply. Tubercle focal rupture in the subarachnoid space causes meningitis. Then the pathogenesis. Mycobacterium tuberculosis bacilli enter the host by droplet inhalation, after which the localized infection accelerates within the lungs and then disseminates to the regional lymph nodes. The bacilli may then seed to the central nervous system and result in three forms of CNS tuberculosis: tuberculous meningitis, intracranial tuberculoma, and the spinal tuberculosis arachnoiditis. In the brain, the bacilli may form small subpiral or subpendymal foci of metamastic caseous lesions termed rich foci. As the disease progresses, the rich foci enlarge and may eventually rupture into the subarachnoid space, resulting in meningitis. Then the signs and symptoms. The signs and symptoms often start slowly and may include fever and chills, mental status changes, nausea and vomiting, sensitivity to light, severe headache, unusual posture with the head and neck arched backward. This is usually found in infants less than 3 months, bulging frontales, soft spots in babies, decreased consciousness, drowsiness, and stroke. Complications of tuberculous meningitis. So the complications include hydrocephalus, cranial nerve palsies, visual impairment, and blindness. Without treatment, the condition may result in a coma or be fatal. Stages of tuberculous meningitis. There are 3 stages. Stage 1 is alert, stage 2 is lethargy, and stage 3 is coma. The feature of stage 1 is non-specific symptoms and signs, no clouding of consciousness, no neurological defects. Stage 2, lethargy or behavior changes, meningeal irritation, minor neurological defects such as cranial nerve palsies. Stage 3, coma, abnormal movements, seizures, severe defects such as paralysis. Diagnosis. The diagnosis of tuberculous meningitis is made by examination of your cerebrospinal fluid, the fluid that surrounds and protects your brain and spinal cord. Cerebrospinal fluid is examined with the spinal tap, also called as lumbar puncture. This test removes a sample of cerebrospinal fluid. The sample is examined under a microscope to make the diagnosis. In some cases, more than one sample may be needed, or a polymerase chain reaction test may be used to confirm the presence of Mycobacterium tuberculosis. Clinical treatment. With a proper diagnosis and medically supervised treatment and support, tuberculous meningitis can be cured. Treatment typically involves taking the following antibiotics for 2 months: Hydra, Rifatin, Rifater, and Methbutol. Thank you.
Thank you.
And we have the last one, Abdul Latif Mahinur, because she had problems with the connection.
Okay.
I will share it right now.